Hi, I'm Abby Wentz, and today I'm going to be doing a cardiovascular assessment. So let's get started. Hi, my name's Abby. I'm going to be your nurse today. I'm going to do some hand hygiene. Can you state your name and date of birth?
Michaela Kemp, March 13, 2002.
So where are you today and why?
I'm at the hospital for a cardiovascular assessment.
Okay, so her general appearance is normal. She's calm. She's oriented ×4, so that's all good. I'm going to move down to inspect her extremities. So do you care to take that off?
Oh yeah, my bad.
While she's doing that, I'm looking at her legs and everything looks normal. She does have a scar. Is that from
ACL surgery.
Okay, so she has a scar and that's about it. Her color is good. She has no lesions or anything like that. Now I'm going to look at her nail beds. She also has nail polish on, so everything looks good. The angle is normal. Okay, and then I'm going to palpate the upper extremities for her skin turgor. Okay, both were less than 2 seconds. Now I'm gonna check her skin turgor on her feet. Okay, both were less than 2 seconds. Her appearance, like I said, her skin looks good. Nothing's discolored. There's no lesions, nothing like that. She is warm to touch, but she's not hot. Her cap refill, let's see. Okay, less than 3 seconds in her fingers. And less than 3 seconds in her feet also. She has no edema anywhere on any of her extremities. Okay, now I'm going to palpate her brachial pulses. And I got 72 for her brachial pulses. They're equal bilateral and +2. So now I'm going to do her radial pulses. Okay. Okay, those were equal and bilateral and +2 also. The rate was 74, so it was very close. So now I'm going to palpate her femoral, popliteal, posterior tib, and dorsalis pedis. So first we're going to do femoral. Okay, they're +2 and normal and equal bilateral. Her popliteal are weak. I would say +1, but they are there and they're equal bilateral. Her post tips are +2 and equal bilateral. And her dorsalis pedis are also +2 and equal bilateral. Okay, now I'm going to check her blood pressure, and I'm going to do her arm, which is her brachial, and then her leg, which is her ankle, and then I'm going to calculate the ankle brachial index. So let's start with her arm. I'm gonna do this arm if that's okay.
Yeah. Cool. That's cool.
I got 118/56. So now I'm gonna do her ankles. Do you remember that 118/56?
Yes.
Okay, and that one I got 120/58. So I'm gonna calculate it. So sorry. Okay, so to do that, I'm gonna divide the systolic ankle, which was 120, divided by
118.
the top one, which was 118. So, and that's 1.01, and the normal limits are 1 to 1.4. So she's within normal limits. Okay, now I'm going to do an Allen test, and I'm going to have Michaela squeeze her fist for about 30 seconds. And then I'm going to cover both her ulnar and her radial arteries. Okay, now you can let your hand out. And there's gonna be discoloration on her fingers and hands, but as soon as I let go of the ulnar, the blood flow should continue. And it did. And it should happen within about 7 seconds, and it happened in about 3 to 4, so that's good. Okay, now I'm going to inspect her chest. The contour is normal. She is a female, so she has breasts, so everything looks symmetrical and even. I'm not seeing any pulsations. I can't see her heart beating out of her chest or anything like that. There's no lifts or bulges. There's no retraction, so that's good. I'm going to inspect her jugular veins to see if there's any pulsations. I'm not seeing any. Now I'm going to palpate her apical pulse. Okay, it's, I would say +2, and it's strong. Okay, now I'm going to palpate and listen to her carotid arteries. First I'm going to palpate, and we do one at a time, so we don't block off the blood flow to her brain. They're +2 and equal bilateral. Now I'm going to listen for bruits with the bell of my stethoscope. Okay, I hear no breathing. Okay, now I'm going to auscultate her heart. First, I'm going to start with aortic, pulmonic, Erb's point, tricuspid, and her mitral and or apical. All sound normal and I hear no extra sounds. Now I'm going to listen to her apical for a full minute. Okay, I got 68. The rhythm was normal and strong, and I heard no extra sounds or no murmurs, so everything is good.